Hello, everyone. Thank you for joining us for the MS in Health Information Management Program information session. So my name is Dr. Memory Ntanka. I am the academic director for the HIM program. I have 15 years of experience in the acute care industry, both acute care and academia. I have a PhD in informatics. I have been an active member with AHIMA and the New Jersey Health Information Association. I've also served as the Health Information Management Manager at an acute care facility. So I just wanted to introduce myself so you know who you're talking to, but I will have Dr. Keck take it over.
Hi, everyone. You can see from my picture that is so not me. I got to get a new picture. Anyway, I've had 30 years working in the field of HIM. I have my PhD in biomedical informatics. I went to my master's in healthcare administration, and I started my BS in HIM at Kane University. I'm an active member of the American Health Information Management Association, our professional association, and I served, let's see where that RHIA and that degree got me. I was an interim senior VP of ethics and compliance, a privacy officer, an HIM director in acute care, and now my final career, I believe, is teaching. So thank you for joining us. So what is the field of health information management? Health information management focuses on collecting, processing, and sharing patient information in a secure and efficient manner. This is the official definition by the American Health Information Management Association. They say it's the practice of acquiring, analyzing, and protecting digital and traditional medical information vital to providing quality patient care. Now, the Health Information Management mission is to equip all of you, the students, with the skills and knowledge to develop, implement, and manage health information and data for quality care, reimbursement, research, planning, and evaluation. Healthcare is dynamic. The world of healthcare is changing faster than ever. That's why our program provides you with the most relevant coursework needed and required by today's healthcare industry. Learning program outcomes, all degree programs, no matter what degree you go for or what university or college, they all have defined learning outcomes for their programs. At the School of Professional Studies, we strive for our students to excel in HIM by providing you with the core knowledge specific to HIM. Our academic program has a set of these learning outcomes which outlines the knowledge, skills, and abilities you will acquire upon completion of the program. Learning outcomes, really what they do is they serve as a guide for students to ensure that you're knowledgeable and also that you're competitive in your profession. Our learning outcomes are in these areas: leadership, privacy and security, ethics, public policy and healthcare policy, compliance and regulatory requirements, classification systems, which really means medical coding, technical applications like spreadsheets, Excel, Access, and research for the healthcare ecosystem. Now, our Master of HIM is modeled after CHIM standards, and CHIM is the Commission on Accreditation for Health Informatics and Information Management Education. It's really an accrediting body that has really an international reputation for excellence in terms of overviewing and approving different higher education institutions and programs. And these institutions and programs have to adhere to CHIM's strict code of ethics and core competency areas. It's a nonprofit organization that has oversight over programs that are conferred by colleges and universities within the United States. What it's really known for in HIM, it's best known as a marker of a great HIM education. One employers and students alike look for when searching for HIM programs, and Dr. Ndanga and I are pleased to announce that we have successfully met CHIM standards and received accreditation, which really comes down to, we are officially an accredited program, right, Dr. Ndanga?
Yes, that's correct. We recently just got up a letter in the mail that we have been accredited. So that's great news, especially if you intend to take your RHIA with us. That will be fantastic.
The career options for HIM graduates, the health information management profession combines the fields of medicine, management, information systems and technology, finance, and healthcare law. The HIM profession is continually evolving, opening the door for expanding roles in those areas. So there's many different opportunities in different work settings. If you're in a traditional setting, you're probably in a hospital, physician office, surgery center, behavioral health, and home health. Then if you're in a non-traditional setting, you're in a pharmaceutical company, software vendor, consulting firms, insurance companies, even correctional facilities and academic institutions like Professor Ndanga and I. Here are a few job titles held by our HIM graduates. HIM Senior Management, you're operating and overseeing an office, an EHR Implementation Manager, Health Systems Operations Senior Director, Project Manager of Health Information Exchange, Data Quality Manager, Chief Compliance Officer, and I think we should also include in this list, Revenue Cycle Manager. Now, in order to be admitted to CUNY, the School of Professional Studies, an applicant, such as yourself, should possess a bachelor's degree from an accredited institution. Now, this is an important part. You don't have to have an undergraduate degree in health information management. It's not required. We currently have students who have degrees in biology, psychology, public health, just to name a few. You need to have a GPA of 3.0 or higher on a 4.0 scale. You need to write a personal statement. You need to write a personal statement and an essay. And keep in mind, when writing your personal statement, make sure you demonstrate your qualities and skills and values that you've cultivated over your life, or how those skills prepared you for attending a master's degree program. Upload your resume. Now provide 2 letters of recommendation. And these recommendations are typically written by an instructor, a professor, a counselor, or mentor, or a current or previous supervisor or manager, highlighting your strengths and potential contributions to the HIM program and to our school. So choose wisely when you ask for those letters of recommendation. Also, an individual interview might be necessary. We use interviews as a way to get you to know you further, right? Beyond that written component of your application, we may interview you as a way to learn more about your goals and assist you in figuring out whether our program is the right one to achieve your goals. Now, we call these co-requisite courses. They're probably sometimes termed as prerequisites, but in our program, you would be able to take these along with your core HIM courses. Students who don't have a prior background in health information management may need to take additional prerequisite courses or these co-requisite course content. The courses are required by CAHIM, that accrediting organization we spoke about. They can be completed at SPS or at another accredited college or university. We suggest that you take these courses throughout their academic schedule and don't leave them to your last semester. Our program is competitive with 33 credits. This is our core curriculum. This is really the foundation of the HIM education that every student must complete to earn the degree. And you'll notice HIM 699, we get a lot of questions about the capstone. It is a course and we can answer your questions at the end, but it is not an internship. And now I'll turn it over to Dr. Ndanga.
So one of the things why you should consider joining us as an applicant is really the tuition rate that SPS offers. So currently the in-state rate is at 5,545, and that's under 470 per credit. I know the out of state has slightly increased this semester, since winter semester, I believe, but it's still very low than most of the graduate schools. So I do encourage you to consider that as a plus when you're applying to our program. So some of the things you should really think about as an online student is the time management. You're looking at taking classes pretty much at your own time in terms of when you can do the assignments, when you can do the readings. Even though we have a schedule for you to submit the assignments, it's not like it's independent study where there is no deadlines. The classes, they have deadlines. You have to submit your assignments every week, but you need to be able to manage your time and just have that self-discipline to actually make sure that you are studying, you are paying attention to what's due, you're communicating with your professors. So, and you also have knowledge of how to use the Blackboard system. There is orientation on this. We can train you, we can help you to figure out how to use Blackboard if you have not been using Blackboard, but it's similar to other online learning managements that are out there. It's just a different in terms of the tabs that you click here and there, but there is orientation, so that should not be a problem at all. The most challenging thing for most students is just that time management, especially since most of you are working adults. We want to make sure that you understand that you will need to put some time to be able to complete your studies. So again, why attend SPS? It's really part of the wider CUNY school, so that's like a big advantage. We are also accredited by Middle State in terms of the school is accredited by Middle State Commissions on Higher Education. And like Dr. Keck said, the actual program is accredited by KHIM. So that's another plus. There is opportunities for potential growth, your job mobility in terms of once you get the degree, or even when you're still attending here at CUNY, there are several opportunities with our career services, even just word of mouth in terms of the other students you will be working with in the classes. Sometimes there are new opportunities that come up as you're going through the program. So our students are mostly working adults, or mostly people who are working, and we understand you have families that you need to take care of. So we actually make the degree fit your schedule in terms of being online, being flexible in how you communicate with your professors, and just being understanding that you have a life and you also need to get your degree completed, right? So we make that possible for you in terms of offering this online MS in Health Information Management. There are a variety of students within New York City and also really around the country. So it's something that's great because you also get to understand what other people are thinking around the country. Right now, we have several students that are out of state that are taking classes with us. So that's a plus, even with different time zones and all that, we make it possible for you to complete your degree. Our faculty are really great. So I would say that because I have seen how they work with the students, how they are very accommodative, and most importantly, they are very knowledgeable about the HIM industry. Most of them have been working in the industry, or they're still working in the industry. So they have a lot of knowledge to actually share with the students. They can share their experiences. They have been either teaching for a long time. Most people have been teaching for more than 5-10 years, which is great because they have seen the world before online to now being online. They understand the student needs. So that's really important. And they are qualified to be able to be teaching with us. Most of them have their RHIS, or at least they have a related experience in the field. So I really appreciate them working with us, and we have a lot of them, especially in terms of adjuncts. There are a lot of adjuncts that you get to work with. So it's not like you take 3-4 classes with the same professor. Chances are you're going to have a different person. And when you're working with a different person, that's a new opportunity to actually network, make new relations, right? So that's another advantage to be taking classes with us. And when it comes to student services, there's a lot of opportunities. CUNY SPS is one of those schools that I've seen that really does a lot for their students. So they have career services, they have advisors, and usually this is one-on-one. You are assigned an advisor that you can work with from beginning to end. There's tutoring, the library, which is actually online resources that you can get, and also the help desk. So they are not just faculty, but even outside, the staff within CUNY actually makes it possible for you to work with them, and even with the different schedules that you all have. So let's look at some of the questions that are frequently asked about the program. These are questions that we've been getting in prior years, so we just compile them to make sure that we can answer them for you, so you can reserve the other questions at the end. When should I apply for your health information management master's degree? The priority deadline is April 6th, and the regular deadline is May 18th. I currently, if you apply and if you submit your application by the priority deadline, there is no application fee. So that's really something to keep in mind. If your applications come in before April 6th, there is no application fee. Is the program completely online? The answer is yes. We are asynchronous. The program is fully online. Do I have to have a bachelor's degree in health information management or health related? Pretty much no. I think Dr. K covered all that part. You do not have to have an HIM degree or a healthcare related degree, bachelor's degree, to be able to enroll for the MS in HIM. Are there any prerequisite courses required? We have 5 courses that we really want you to have, but we also consider them to be core requisites, which we covered before. You can still take them as you are progressing through the master's degree. Can I attend the program on a part-time basis? Yes, you can. It is flexible. You can be full-time, you can be part-time. And the other question is, when and where may I get an application? I will kind of I will put it in the chat, so you have the link. But if you go to our website, you can actually be able to apply from there. But I'll also post it in the chat in a few minutes. So that's really all we wanted to share with you. We want to reserve most of the time to be able to answer your questions. But if you have any questions, you can either email me, Memory Ndanga, or Dr. Keck, which is Kathleen Keck. The email address is provided on your screen right now. We also have Teresa, who is our program specialist, and she's actually the advisor for all master students in our program. So she will be the best person to actually contact if you really need advice in terms of the classes you're taking or anything like that. So what will happen is, if you submit your application and you get a response from us, she'll be the first contact in our department that you can work with to be able to arrange the classes and also to understand what is the next step. So we also have Lucas' email on there, who is the director for admissions, and Felix, who is the financial aid manager. If you need any of these emails, you can email me and I'll resend them to you. Thank you very much for logging in, and hopefully we'll see your applications. And if you have any questions, please do not hesitate to reach out to any of the HIM team, and we'll get back to you. Thank you.
Thank you.